Good afternoon, and welcome to today's community briefing. Today we'll be hearing from Mayor Sarah Karen and Shannon Britt with Prairie Lakes Healthcare. Mayor?
Thank you, Nick. The Unified Command Team met today and discussed ways to prepare for the changes we will likely experience. At this time, the city is experiencing an overall reduction in traffic and in business around town. People are working hard to keep social distance, and it shows. Our healthcare professionals are seeing increases in calls, but not in walk-ins at this time. They're actively preparing with the expectation that there will be an increase at some point in time. Also, at some point, employers will learn of a positive test amongst their staff. The city's practice will be to continue to follow the federal privacy rules and the CDC guidelines for hygiene, housekeeping, and social distance. 2 weeks ago, I told all city employees that they should use their own discretion in deciding whether to come to work or not, and to work with their supervisor to determine the appropriate form of leave available. Nobody should report to work if they're feeling sick or have a fever. If people are able to work at home, they're allowed to. We're still able to provide our essential city services, although the turnaround time may be a bit longer for some things. This is a rough patch we're going through, but we're doing everything we can to maintain control and to get us back to 100% as soon as possible. And now I'd like to introduce Shannon Britt, the Infection Control Coordinator at Prairie Lakes Healthcare System.
Thank you, Mayor. At this time, if you've seen the updated numbers from the South Dakota Department of Health, Cottington County still has 1 case of COVID-19. We are seeing some community spread in our neighboring states. In Minnesota, Wyoming, and Nebraska, they have community spread in designated areas. Iowa has widespread in their community. North Dakota and Wyoming, their community spread was undetermined as of 12 o'clock today. Just giving this information so you can decide for traveling is why we're also still asking for social distancing and keeping close to home at this time, because counties or states around us are seeing community spread. I was asked to define how the Department of Health goes through contact and updating their website. If there's a positive COVID-19 test at a reference lab, that reference lab will let the South Dakota Department of Health lab know of the positive results and provides them with the patient information. The positive results are then contacted to the submitting laboratory or to the facility the lab was sent from. The submitting laboratory will then contact the ordering physician. The physician will contact the patient. The South Dakota Department of Health will conduct the contact investigation. Once the investigation is complete, it is then reflected on the website at the time of update. The South Dakota Department of Health did state today they are working on clearing up their backlog and hope to be done by Monday. At this time of update, there are 41 positive cases in the state of South Dakota with 819 negative cases. In regards to definitions, isolation. What isolation means is a separation of people or group known to or believed to be infected with a communicable disease. And these definitions are directly from CDC, so that way we keep consistent with our definitions. Quarantine. In general, quarantine means the separation of a person or group of people reasonably believed to have been exposed to a communicable disease. Social distancing. It's a word you've probably heard a lot from all of us. Social distancing, it reminds people to stay out of congregate settings, avoiding mass gatherings, and maintaining a distance of 6 feet or more from others when possible. A shelter in place means staying home and limiting movement outside of your homes even more than with social distancing. To reiterate on recovery, when people that have COVID or suspected of COVID-19 can leave their homes, is having 72 hours being fever-free without the use of medication to reduce your fever, or an improvement in your respiratory symptoms, and at least 7 days after the first of your symptoms, whichever those are the longest.
Yeah, I just have a couple of questions. Shannon, maybe for you first, and that is, over the noon hour, we received a call at the radio station regarding, from a sewing club, and they were asking, would there be any need, would it be helpful to help sew masks at this point in time? I know some parts of the country are coming up short. You had said earlier, we're not here yet, but any thoughts on that?
We are still evaluating. I love the outpouring of people in our community. We're, again, so blessed in so many ways. We're taking information at the hospital on these people that are offering, and so they can call in that, or I can get the information from you afterwards. Right now, at this moment, we don't need the masks, but we are evaluating. We're working with our other healthcare entities in our community so that when we do or we feel the need to ask for their assistance, then we have their contact information to do that. Right now, we don't, but we are really evaluating moments that might need them or what departments might need them more sooner than others.
She said she's listening right now, so would you prefer she might contact you?
That would be wonderful.
Okay, at the hospital?
Yes, please.
And how would she do that?
She'd call the hospital at 882-7000
Okay.
and ask for Shannon Britt.
Okay. And Mayor, if I could just shoot one question at you, and that deals with reports today that we are now seeing layoffs in the community, and wondering what is a message you might just kind of share with us along those lines. We're hearing it might be 3 weeks before checks start arriving.
Right, and I feel for those folks who are getting the layoff message, and there probably will be more coming. We want to help the employers as much as we can. There is a community fund being established, and I don't think it's up and running yet, but it's going to be administered by the Watertown Development Company. As you probably recall, the city of Watertown is donating toward that fund, as are many other entities. So we're trying to help our community in every way that we can, and I think that with this, as this progresses, we probably will see more layoffs coming in the future.
And the only other question deals with supplies in Watertown. We're still hearing reports of shortages on some of the shelves, some products, namely toilet paper and other things like that. What would be your message to the public on that one?
Well, they are able to restock, and so we are seeing the supply chain working. That hasn't shut down, and we don't expect that it will at any time. So maybe you can order your supplies in advance online or over the phone for delivery or pickup, and they'll call you. And I don't know how the grocery stores are working, but there's no need for you to pop in on them and get these things. If you place an order, I'm sure they'll fill it when they can. Thank you.
Do we have any more questions?
Oh, yeah, just one. Obviously, today was the first day of the city council ordinance, and I guess, have you seen any effects yet or anything like that?
Oh, I'm glad you asked that, and that's Dan Chrysler with the Public Opinion. So last night, or early this morning at midnight, the new city ordinance that was passed by council went into effect. And I'm happy to report from the law enforcement side of things that we had 100% compliance with our bars and our restaurants. And so we anticipated that. Our community has been working with us fantastically. And so we knew that was coming, but it's nice to be reassured that we had 100% compliance and there were no issues on that side as far as law enforcement concerned. Good question. Thank you. Any other questions? Okay, and we will continue these 3 p.m. daily briefings Monday through Friday, and so make sure you tune in on Facebook Live. Also, if you are in a position to volunteer, make sure you're going to that website, volunteer211.com. Especially if you have a skill out there that you can share, we'd be happy to have you. So make sure you volunteer if you're able to, and we'll see you tomorrow at 3 p.m. Thank you.